times a day. So I want to make sure that they know that the university is here for them. Haven't had any major hiccups thus far of delivering my instructional material. And as you know, all the classes for the summer are currently online, and we're using a hybrid approach for the fall semester. But I'll be honest with all of you, and I'll be transparent with me. I miss my students. I miss seeing them around here. I miss having them come to the office. I miss seeing a lot of you walking around campus. I miss coming to your offices. But what's his name? General Richard Honoré. Many of you perhaps will know the name once I share it with you. It was President George Bush who sent him into New Orleans after Katrina. He wrote a book entitled The New Normal. And in essence, what we're dealing with right now is the new normal. And someone said, well, would you be happy to get back to the old ways? And I said, no, mainly because it's the old ways that get me in trouble as to where I'm at right now. So we're going to learn from what we are doing right now. We need to take the best practices that we're getting from all of this and move forward here at the university. So look forward to seeing all of you throughout the rest of this. Look forward to seeing you when you return to campus as well.
Thank you, Dr. Hendricks. All righty, we have a representative from the Counseling Center. Are you there? I think I saw you on.
Okay. All right. I was talking
Yes,
on. Good morning, everyone. My name is Tina Young. I'm the Associate Director of Clinical Services. So thank you for inviting us to this panel. I'm here to share a little bit about kind of how to keep our mental health in check when we work from home and also when we return to work. So an online international survey back in 2019 revealed that 99% of respondents reported that they would like to work remotely at least some time for the rest of their career. And some of the top benefit, of course, include flexible schedule, working from any location, working from home, and more time with family. However, when we began working remotely this year, it was not really by choice, but a quick option that also brings a lot of challenges, like having difficulty unplug from after work, feeling isolated and lonely, and having issues with collaborations and communication. And of course, when we're at home, we're not immune from distraction from home. So how to manage stress and mental health become a very important topic. And some of the things I mentioned may be already what you're doing at home, so kudos for you, and some may be still a goal of yours. So the first important thing is to create a work schedule that really works for you and your department. So this really requires regular and constant communication with your work supervisor, colleagues you collaborate with, and of course your family. One thing that when we're working from home is really negotiate the space with family. So who's using what space and when? If you have young children, who take care of them and who's rotating, watching them based on your schedule, and who's watching their homework or online school schedule. Last thing I want to mention, which is so important, is this is an evolving situation. So it's important to accept that it's okay not to feel okay, that things may not go as planned. And it's okay that some days would feel better or not than other days. Like, Amanda mentioned in the beginning that when we return to work, everyone may be on different schedules. So when that time comes, know that it's understandable that you may have mixed feelings about it. And it's okay to feel that way, because some of the routine that you finally established working from home would have to be tossed out of the window. And some of the things in routine that you were used to when you're working in the office may need to be reestablished again. So to help with transitioning to office, you may consider three things. The first is really be understanding of each other. So returning schedule may be different for everyone. We may not know what each other has been dealing with and going through during this time. So it's really important not to assume that the team will immediately return to what it used to be and that when everyone is back. And so time is really needed to reassemble the team again. The second one is be flexible. So with any transition, flexibility help us to be resilient and facing with any challenge. So it can also, we can see it as an opportunity to recreate a work culture and atmosphere that our team is longing for. Last but not least is be helpful. So this public health crisis has impacted many aspects of our lives. So sometimes when we focus on worrying about our life, we may feel alone in this and miss the opportunity of seeing something bigger than us. So as we begin returning to office when time comes, be helpful to each other. You never know that the gesture you make can make someone else's day, and the act of helping can also benefit your own mental health. Thank you.
Thank you, Dr. Young. All righty. Did we have anybody from nursing who was able to join us? Didn't see that they were able to come. Okay, Crystle. We have Crystle from Wellness.
Hi, everyone. My name is Crystle McIlveene. I am the Wellness and Benefits Specialist. So I just wanted to touch base on what we do here. We've been offering several fun things. Just FYI, today is the last day that y'all can order the Fitbit at a discounted price. So if everyone wants to jump on there and get that done today, you can get the Charge 3 for $60. That's one of the programs we're running right now. We also have our Live Healthy, yes, like Tammy's showing. We also have the Live Healthy Lions going. We have it all the way up to the end of July right now, where you can sign up for personal challenges and snap challenges. With everyone working from home, we couldn't do our big group challenge this year, so that was one of our programs that we did for y'all. We also have Catapult currently coming out on August the 10th and 11th for y'all to be able to get the wellness check for your two-step program, which is due August 31st, just FYI. If you haven't finished your two-step program, you'll want to go into My eBuy and get that completed. We also have the mammogram bus coming out on May 13th. Hopefully those dates all stay the same. I'm sorry, July 13th. I went back a few months. And we're just here for you any way we can. We put tons of wellness newsletters in our HR newsletter. We have the mental wellness that we put in there. We have all of our programs. So if you're not reading the HR newsletter right now, you should start reading it, because that's where all the fun employee wellness stuff is going.
Thank you very much, Crystle. All right. Emergency operations.
All right, how y'all doing today? Let's see here. We have some questions that came through, and I don't remember what they were.
Right now, you're just introducing.
Oh, all right. So I'll get to those questions in a minute. Apologize about that. All right. So today we will send out the fall reopen plan. There were a couple of minor changes that were made last night. I had some words in there incorrectly in the wrong order. So we'll be sending out that recovery plan, or that fall reopen plan. Everybody will get that this afternoon. I'm sure there'll be some questions coming from that. But other than that, what we're noticing a lot of right now in Hunt County, last night they reported 61 new cases in the county. The thing that's positive about all this is that the hospital occupancy rate is staying the same. It's actually gone down a little bit. So in Hunt County and within our region, our hospital bed usage rate remains below what most people are seeing throughout the region. So a bit of good news on that is that we do have the bed space available for everybody. Other than that, the fall reopen plan is what we've been spending a lot of time on. We've made a whole lot of PPE orders for everybody. We're getting some new plexiglass shields, barriers out there for the desk. The ones that we had created, you'll see those throughout campus right now. They have the wood around them. They're 3x3. They look a little big. They look a little bit bulky. They did what they were intended to do. They provided the opportunity for people to have a barrier until we got nice face covering there, Dr. Hendricks. We're working on ordering a whole lot of those also. So we're getting some new barriers in. They're going to be streamlined. They're going to be thin. They're not going to have the wood barriers around them. So you're going to actually like using those out there. And we're getting a lot of the same barriers for the classrooms. So the main thing we're working on, getting that fall reopen plan to everybody and getting all the PPE ordered for our August return.
All right, thank you so much. Okay, let us go to our next group. That would be IT. Jeremy.
Hello, hello. Hope everyone is doing well, and tough act to follow up behind Mr. Derek Preas there. But I hope everyone's doing well. And yeah, just want to kind of give you guys a little bit of background on what we got as far as what to expect when coming back to the office. I understand that, we all might have left in more of a hurry and just grabbed all the technology and pulled the cables out and pulled whatever monitors out of which walls and stuff like that. Rest assured that if you walk into that situation, into your office, by all means, we are here to help. Contact the help desk, email, or call at the 6000 number, and we will be ready to help if needed to put your office back together. I understand that some of that can be kind of challenging. Again, we might not have thought about it when we were in that mode of just trying to get on out. So again, just please utilize us if you feel that you need to. Talking about how we might be still doing the work from home thing for a while, as indicated, just to give you a little bit of, I guess, at-home etiquette, and especially in terms of video conferencing. Yes, we're using Zoom. Yes, we have Teams as well. Just for, I guess, a broad overview of what would help out if we are in big meetings like this, or sometimes if you notice that your internet connection is not as stable as it could be, reducing the video bandwidth of the meetings. Yes, right now we are using a lot, and we see a lot of people using video. That's great, and it seems to be working great. But if we all do our part, and we notice that sometimes our meeting connection is a little unstable, by all means, reducing your camera, turning off the cameras does help increase the bandwidth for the actual meeting to take place. Again, having the content that you need is more so, I guess, more important than seeing all of our lovely faces. Although it is great to see people. I'm a woo, and I like to see the interaction. I can't wait to see you all in person, I'm telling you. But also with that is, reducing the feedback in terms of audio and things. And so having earbuds or headphones also helps in that matter as well. When we're in big, large crowds, if we have open mics and it's open discussion and dialogue, again, just being able to have it over your ears. That way, when you have a lot of mics opened up at the same time, we're not getting that feedback from speakers and things like that. A lot of the conferencing platforms now have noise cancellation. So again, I bet you if we all unmuted our mics, there'd be a good chance that there wouldn't be that much feedback, but again, we want to try to reduce it. With that being said, background, if we do have your video on, I would say the only thing that I would say would be kind of a one that helps with having your video on is if the constant movement also picks up and takes up bandwidth. So like fans in the background, that sometimes will eat up a lot of bandwidth and a lot of movement, and that sometimes will kind of hurt your meeting in terms of the quality. So just keep those kinds of things in mind. If you're in a meeting and things might not be as stable and things, either try to first look around. If you have a fan on, turn that off, or then if things continue, then turn your video off and just listen in and have audio. Zoom does allow you to put a picture up on the accounts. I do believe in some, well, I'll take that back. I know in some of the accounts there you can load a picture up, and I don't know if the free trial concept right now allows you to put a profile picture up or not. And I know we'll get into some questions about the future of Zoom here in a little bit. But yeah, like I said, we're here to help. We're here to serve. And if you have questions, by all means, feel free to always email. One thing that in IT that we're trying to instill right now is that we're trying to be better today than the day before. And so I hope to kind of continue that as a mission for us. So hope everybody is doing well. Thanks, Amanda.
Thank you, Jeremy. Much appreciated. So if y'all have any questions, please go ahead and put them in the chat. If you have any questions you don't want everybody to see or you want to ask anonymously, please direct them directly to Kim Jeffries. And then she'll go ahead and put them in a list only a couple people can see, so I can make sure to ask them. So I'm going to go ahead and get started asking questions. We also have a few people on here from HR, so if you have any questions you think that they're, well, plus we have people from a lot of other departments on here, so if you have other questions you think that maybe one of our panelists can't answer, I'm sure somebody on here might be able to answer it. So I'm going to go ahead and get started with some questions. This might be a question for EOC. If COVID cases continue to increase, are there any plans to continue working remotely into the fall or spring?
All right, so as of right now, I'll get there in a rather long answer. So right now, COVID cases are increasing. They're increasing across the county, they're increasing across the region, and they're increasing across the state. So if you remember, our fall return to work plan showed that beginning July 1, we were all going to start coming back to work. The direction that we have right now is that you need to speak with your supervisor. The intent is to continue working from home if at all possible. Because of our recent spikes and recent upward trend in the case counts, we are asking folks to work with their supervisor and make that determination whether you're an essential personnel or essential that needs to come back. So work with your supervisor, and we are recommending that if you are able to work from home and continue that working from home setup that you have, speak with your supervisor so that can continue. As we approach the fall and we start getting closer to the time for all students returning, we will continue to look at the current trend of the current cases to make a determination of what's going to be happening. But as of right now, things are still on track for the fall reopen or for the fall return. And for the third wave of our return to work plan, we are kind of pushing that back. We're asking folks to look further instead of July 1. Let's make that return for you later instead of now.
All right, thank you. Jeremy, this question is for you. Given the productivity of faculty and staff during remote work, will the university continue its license of Zoom? Will other distance work items like hotspots still be available in the future?
So as of right now, yes, as long as we are still going to the recommendation of having more work from home and remote work locations, there will be hotspots available. We do have a limited amount of hotspots right now. We can always continue to evaluate how many we have. The EOC has a list of how many we report to them, how many we have available. To my knowledge, and I don't know if I will misspeak on the process of it, but if they are in need of a hotspot, I think they reach out to EOC first at that eoc@temec.edu email. Is that correct, Eric?
That's correct.
Yep. And then we continue to work on that process. Now, as far as the future of Zoom, yes, Zoom has been extended out on this free trial until the end of August. However, I will preface with we are actively looking at possibly getting a CITE license for the university on top of that. So one, just to try to get away from having to continuously negotiate the free trial and what the current stages of where we are with the COVID response, we are actively looking at doing a CITE license with Zoom. That's going to be right now. There's a couple different options, but at a bare minimum, it'd be for the faculty and staff based off an FTE scenario. And so we're currently going to look into those. It'll also come with the options for there's a webinar. 500 max or the 1000 max, we are looking into making sure that those are bundled into this pricing and negotiations as well. So again, and those are not going to be necessarily assigned to one individual or one department. Those will be able to be used and scheduled and move around accordingly if we need to use them. So they're not going to necessarily be assigned to one individual person or group. And also with Zoom, with that being said, I want, and thank you, Jazz, for kind of reminding me about this, but Jazz has also information and training available in terms of some resources for Zoom and for Teams. Again, I don't want to dismiss having the use of Teams. Teams is also a very good tool to use. It comes bundled with our Microsoft Office 365 agreement, which all of us do have access to. And so again, I would take advantage of Zooms as well, or sorry, Teams, especially with those maybe one-on-one meetings or interdepartmental chat, things like that. Again, it does a lot of the same features. And again, it's just different options to have. But again, training and development does have some resources that Jazz would be able to provide and get with her if we do need them. And if we do need some one-on-one training, again, IT and Jazz both, we're willing to step up and help out if we need to sit in with you and get stuff set up or how to schedule, if some of those training resources might not do its justice for you. So that's what I have.
And while I have you, Jeremy, is there a place where people can go to find out how to access the Zoom license and how to access Teams, how to get it on their mobile device? We've had some questions about those kind of things.
So, yep, absolutely. So if you go to the IT site and under form, or actually, it's not under forms, but it's under, one second. So
do you want me to do
everybody.
Share screen for you?
Sure, or if you would like, you can do that.
Yes, I will make you a co-host so you can do that. All right.
All right. So if you just go to CITE or the IT webpage, and you go under work from home, and you can go down here and there is going to be some chat collaborations, Zoom meetings. And when you come here, temporary, again, we're changing this, it'll be to the end of August. But again, we can contact, if we need to get in touch, we can go to this temporary trial accounts and get set up. Keep in mind that trial account, those do last. There is a capacity right now. So we are kind of looking at those that are actively using them, and then we can see usage reports. And if individuals are not using them, we repurpose them for those that are actually in need right now, trying to get them. So again, keep in mind that there is, I think, I'm not 100, I want to say about a 500 limit right now of those accounts. And so we do check usage. If you've used it once, that's great. But if that's all you've used it, we do repurpose those. So just keep that in mind as well. And then same thing above here, getting into Microsoft Teams, how to get in and also get Microsoft 365 and whatnot. Some of those options are available as well. So, and if you have questions, by all means, contact the help desk, contact myself, and we primarily the help desk, and they'll be able to forward those on to if it's a technical question, onto the technical team's training question. It'll be IT, or maybe possibly we can get help from Jazz. If there's the question about getting a education license apart from the free trial, those questions go to Mallory Denny. However, again, I would hold off on doing a lot of those because of our negotiations of trying to get a site license.
Thank you. All right. Let's see. All right. This question is for the HR team. So whoever from HR would like to take this one. How will the hiring freeze and budget cuts impact merit, equity adjustments, and raises?
Okay, that would be a great question, but it's not really an HR question. We don't get to decide if there's going to be a merit pool. That's decided by our budget and by our enrollment. We need to get our evaluations completed for the HR side so that you'd be eligible to be at least considered for one. So if you haven't gotten all of your evaluations completed, we need to get those done by July 17th.
Okay, perfect. I think I saw Sarah Baker was on here somewhere. Sarah, did I see you on here?
I'm here.
Yay! Would you be able to help with the answer to this question?
Could you repeat it? I'm sorry.
Oh, yeah, absolutely. How will the hiring freeze and budget cuts impact merit, equity adjustments, and raises?
So I can only give you a little bit of information, but what I do know is that at this time, the president wants to have a merit plan on the table. But a lot of that is going to depend if it will be able to remain if there are additional budget cuts after the legislative session meets. And then I've not heard anything regarding equity adjustments or promotions, that type of thing. I think that's going to be dependent on the funding sources available in each individual department, and then of course working through the normal HR process.
All right, thank you.
You're welcome.
Okay. I think this would probably be this might be an HR question. Will the university pursue remote work for certain positions long-term? An infrastructure of sorts is in place and many employees are capable of working remotely in their current positions. Is this something that is being considered even as a means of saving office space?
We work with supervisors now that have requested that, and as the job positions that can be done from home, we have given approval, but it's a kind of a case-by-case basis. We have a good discussion with the supervisor and maybe their VP of that area to ensure that it's okay with everybody, but we do consider those, yes.
Thank you. Okay. This, I think, would be for, I think this is an HR/budget question. Is there any consideration of an allowance for the internet for work-at-home employees, similar to the cell phone allowance? I'm guessing on a more widespread scale than has been traditionally.
Amanda, I can try to chime in. And I'm looking at Tammy, but I think we would actually just need to review our cell phone allowance to see if there's enough gray area to include internet, or if we actually need to make an amendment to that. I know that's come up a couple of times as we're in this, and I think we have all hoped we would be able to return to more normal operations, but that may be something we now have to look at. I think that policy may be owned by either payroll or HR, since that's how it's processed, but we could look into that.
Yes. What she said.
Sorry, Tammy.
That was a perfect answer.
Thank you. Dr. Hendricks, this is for you. Will educational opportunities or activism be available from home or on campus in the fall for faculty or staff who would like to be involved in improving equity on campus?
Good question. I don't have the direct answer for that. I would say that we have to get with your senator from your academic department, bring that issue before faculty senate, and faculty senate can give input on that.
Okay, sounds good. Thank you. I have a question for the EEOC. This is directed at, given the response to COVID, are we going to change how we handle flu season? Since flu season is also generally pretty dangerous, are we going to change how we handle the university's response to flu season?
I think right now, everything that we do has changed. I think what we see, not only from a university perspective, but from a human perspective, societal change, everything has changed. So I'm going to go out on a limb and say, yeah, we are. We're going to be more focused on maintaining a healthier, safer, cleaner, more sanitized environment. Once the news media and once the health professionals, once whoever decides that COVID's over, our response is not going to be over. So I think our change is going to be, how do we adapt to this new normal? So although I can't give you an exact answer on what we're going to do to change, I do know we will change. Everything's going to be different from a health perspective, from a sanitization perspective, and from a basic hygiene perspective. I just don't know how that's going to look in September. I don't know how that's going to look in December. But yes, it will be different.
All right, thank you. All right, this is a question for Dr. Young. Since we will be continuing to work remotely, will there be any programs or resources for us to keep our mental health positive?
Definitely. The Counseling Center has been providing the same level of services since we began working online. So all services are still online from individual to group, and we're hoping to have more workshop that can open for everybody in fall.
All right, perfect. Thank you so much. Okay, does anybody have any other questions? I think that was all the questions we've had submitted thus far.
Amanda, I would like to chime in on what Dr. Yang said also.
Yes.
Over in Binion Hall, we do have the community psych counseling clinic that's available for university employees and those in the community as well, because over in the counseling center, perhaps they may focus in on student issues. But if anyone is desirous to use the community counseling site clinic located in Binion Hall as an employee or even from the community, that's also readily available. Easily dial 5637 to set up an appointment for that.
Perfect. Okay. Well, does anybody have anything that they would like to plug or promote at this time, since we don't have any more questions? I'd like to give anybody the opportunity to promote any resources that they have or any events that they have coming up if we don't have any more questions.
Amanda, I'd also like to chime in on that. We also have the Employee Assistant Program for anyone looking for mental health for an employee standpoint. And we also have several programs going out, several webinars. We had one last week for mental wellness. Just wanted to remind everyone on that standpoint.
Crystle, is there a nice convenient place where people can go to look for those resources?
The Employee Assistant Program is posted on our website, and then any webinar that we send out, we do on the listserv and also to the Employee Wellness List Distribution Group.
Awesome. Thank you.
Welcome.
Anybody celebrate a birthday this month, I'll be happy to get you one of these t-shirts here. If you celebrate a birthday this month, we're done dying, wear a mask.
Those are fabulous shirts, Dr. Hendricks. I know I've seen you post them on Facebook. Is there a place where people can go and get those?
Sure, contact you directly.
Okay.
Got you covered, Molly.
Real quick, I want to also just provide an update on our VPN. Most of you know that I think the majority of us have switched over to what we call Global Connect to get into our VPN, as opposed to the Cisco Anywhere Connect. There is still a small list of individuals that are still trying to use that Cisco VPN AnyConnect, and we just need to try to get you migrated off and into the Global Connect VPN. That you have been sent emails and whatnot, and by all means just kind of spread the word and help me out if you know of anyone, or just ask through your daily conversations, have you transitioned over to Global Connect? That would be great.
All right, perfect. Thank you so much. Another question came in. This is for EOC. Will we have a mandate on wearing masks throughout campus or in departments?
All right, so the way the face coverings stands, that for in classrooms, healthcare areas, and a few other select areas on campus, it is a requirement to wear face coverings. Outside of those areas, it is highly recommended to wear face coverings. So the mandate is for classrooms, instructional and research spaces, healthcare providing areas, UPD, a few counseling areas, and then each dean or director of their respective department or college has the ability to make that decision upon themselves to make it required or not in that other area. So that's where we're at with face coverings.
Okay, thank you much. Does anybody else have any other questions they would like to submit? I'm happy to give people 20 minutes back of their day. Oh, question, where can people get a TAMUC logo mask on campus?
All right, so we have ordered 16,000 logo masks. They're going to be in sometime in mid-July, and then we will be able to get those out to faculty, staff, and students once they get in. We're going to work on a second order today. So Dr. Hendricks, if you want to put up that mask that you had. That face covering right there is, we're going to work with the vendor that did that to see if we can get some more of those in. The problem that we originally had with that one is they weren't going to be able to make 16,000 to send to us. So we've got one that's a bit smaller than that is logoed. But so that's how you're going to get it. We're going to have them in on July 15th. You'll receive them from your director or your supervisor. And then from there, we're trying to work on some options to have some additional points of distribution so people can buy some possibly.
Will the university provide cleaning supplies and additional hand sanitizer?
Yes.
In what manner will that occur?
Okay. I'm still in answer the auditor's mode. All right. So whenever some people are laughing, they got that joke. Okay. What was the question?
There have already been a lot of PPE deliveries around campus for various departments that have requested them. So I would first work with your department or your admin or your supervisor to see if those orders have already been placed. And then try to do it as a department, not sending in individual, hey, I need this for my office. Your department may have already done it. So please coordinate with your group. Then as a group, they can reach out to EOC and start requesting those. Because we've already filled about 50 different PPE orders across campus. So you may have stuff waiting for you when you get back.
Okay. Let's see. Oh, and I can answer this question. We will be posting this session. We are recording it, and it will be posted on our brand new YouTube page. So I will be sending out a link to all of the attendees, so you'll be able to see it in our other videos. Question for y'all in EOC, temperature checks. Is that going to be a thing?
There are a few areas on campus that will have temperature check requirements. We do have additional thermometers available should a dean or director of a certain location require temperature checks. But right now they're going to be done at, why can't I remember this one? UPD, nursing, counseling, student disability resources, children's learning center, tours. I believe that's where we have it set right now. But if a certain department or location on campus is interested in finding out if temperature checks are best for your area, reach out to your dean or director, get with them, have your dean or director give us a call or contact us at EOC, and we will discuss with them the option of temperature checks. What we want to tell you with temperature checks, it's a good tool to supplement or add to an existing routine. Temperature checks by themselves is not a good defense on COVID. It just simply lets you know something at that moment. So we don't want people using temperature checks as the only tool of protection.
Perfect. Thank you. Do we know if like the cafeteria and the other food locations on campus, will those be open in the fall?
They will be open with modified schedules and modified options. I believe the cafeteria right now is looking at grab and go. So the places that are going to be open will have a different look when you walk in.
Okay. Personal interstate travel, or travel, you know, for university business. Are there any additional guidelines regarding travel?
All right, so you said interstate, so I want to answer this in 3 different ways. I'm going to first answer Texas travel. So travel within domestic travel is restricted to business essential only. Within that, if you are traveling with business essential travel, you're limited to 1 person in the car. So travel is going to be very different this semester. It will be very different probably for a long time. But right now, domestic travel is restricted to business essential, critical mission objectives for the campus. It's limited to 1 person per vehicle, and you still have to have your safe hygiene practices. International travel is not being approved from the System Risk Management Office. There has to be a direct exception provided by the president to the system office for international travel. I would pretty much guarantee international travel is going to be very hard this next semester. Now, so let's see. If somebody is traveling back to the United States for international travel, there are some mandatory self-isolation restrictions that are upon certain countries coming back. So for people traveling, they have to remember that. If you're doing personal travel, there are restrictions that might put you in isolation when you return.
Are there any restrictions on interstate travel, isolation restrictions for interstate travel that is personal?
There are from other jurisdictions. So if you look at New York, Connecticut, New Jersey right now, they are restricting travel from Texas. So if you travel to some of those places, they may have restrictions on quarantining before you enter those areas. So it's really going to be up to the jurisdiction. As far as the university, no.
Okay, thank you. Will there be COVID testing available?
Okay, so that's another long answer, and I'll try to shorten that up. We are working with Texas Division of Emergency Management right now to set up a testing available prior to August. That's going to be open for faculty, staff, students, and our community in this area. Not sure about the specifics, so that's one testing that we're trying to get set up. Upon the fall return, the A&M system through the Health Science Center is working on making tests available for folks, but it all depends on how many they can make, how many they're going to be sent out. So there is broad discussions from a system-wide perspective to make testing available. If they do have it, if they do have the test available, yes, we will. We are doing everything we can to have ample amount of testing options for our faculty, staff, and students.
Thank you. I have a couple of questions that came through about the grab and go. When will it be available? And food, rather, grab and go food. When will it be available? And will the people preparing the food be required to wear masks and gloves during preparation? Those kinds of things.
Jennifer Perry, you on?
I have not seen her.
So I don't know the hours. I don't know the exact hours, but I can tell you that Sodexo does have some pretty strict requirements for PPE and burial protection for preparation of food. They're following not only the A&M system A&M-Commerce guidelines. They're also following the health department guidelines and food preparation guidelines. So they have a lot of guidelines and restrictions that they will be following. I can't answer you on the hours because I don't know.
They're going to open in the fall for faculty and staff, but I would check with their website for the most up-to-date information on their hours.
Okay. Another question for EOC.
Amanda?
Yeah, sure.
I was just going to jump in real quick and just kind of add to that on the help desk side of things for CITE. We are accepting still people to come in and do face-to-face interaction. Obviously, we do have the barriers up and stuff, but we are limiting that to having 2 individuals in the area at one time, in addition to the help desk technician. So a total of 3 people will be in that area at the help desk. We were asking that is being mindful and being acknowledged throughout. We've had some where they try to come in and to have more than 2 people at a time. We have set up kind of markers, steps area, 6 feet apart, kind of a waiting line if need be. Again, just want to let you know we are accepting people to come in face to face at the help desk, but in that area, in the help desk room alone, is going to be maximum of 2 at a time for patrons. So just keeping that in mind and help us all do our parts by respecting that as well. Again, we have 1 technician up there, and they'll be masked and gloved and things like that if they need to be.
And has the phone line, and the phone line is still being manned so people can call instead?
Correct.
Okay, and if people are having trouble, you mentioned the VPN earlier. If people are having trouble connecting to it, they should call the help desk?
Yes, by all means, please have them email the help desk, tell them that they need the documentation or walkthrough, and they can remote in and help get that squared away. Some of it, I kind of went through some of the chat there, and it could be that Cisco just needs to be disabled, and that might require a technician to help get that squared away as well.
Okay, perfect. Thank you. Another question for EOC, can individuals use a face shield instead of a mask face covering?
This exact question came up on a CDC phone call with all higher ed and everything like that. And they highly recommended that no, a face shield does not adequately substitute for a facial covering. The face shield being the plastic that people wear in front of their face. It's usually for, surgical procedures and stuff, or when things are going to fly in your face. That is not an adequate substitute for a facial covering.
Okay. We have about 7 minutes. So if you have any other questions, please send them through.
Amanda, I would like to make one statement before I have to go. Thank you so much for organizing this and the others. There's a Latin expression that says in locus parentis, which simply means in the absence of a parent, we serve as surrogate moms and dads and brothers and sisters for a lot of our students. A lot of our students are lonely. A lot of our students are missing us. So I appreciate all of you who are doing it, but even with your student workers, if you get a chance, send them a nice little email or a little text letting them know that you're still thinking about them, because students are dealing with what we call separation anxiety. They're missing us just as much as we are missing them. So if we could always keep our students at the forefront, anything that you can do to reach out to a student worker or reach out to a student that may be in your classroom, just send them a little note that you're thinking about them. It'll go a long way making them feel good as well. So thank you for doing that.
Thank you, Dr. Hendricks. Okay, well, if nobody has anything else they would like to add or any questions they would like to ask, we'll go ahead and wrap it up. Thank you so much to all of our panelists. If you have any other questions that you think of afterwards, please feel free to go ahead and send those to staff council, and we will go ahead and we will send those to our panelists, and we will get you the answers. That is not a problem at all. So thank you all for coming. Thank you, panelists, for answering all the questions. This was a lot of really great information. Again, we are posting this on our YouTube page, so you'll be able to view all of this great information at any time. Derek, is there a time, what was the time you said when you were going to post the, or send out rather, the fall plan for return to campus?
Today, this afternoon.
Today? Okay. So everybody will know to look for that in their emails. So thank you all for coming, and enjoy the rest of your day.